Hello and welcome. Thank you for attending this presentation on the CRNA Preceptor Training module. This training was developed to address the identified gaps in the consistency and effectiveness of clinical preceptorship for student registered nurse anesthetists or SRNAs. As a part of my Doctor of Nursing Practice project, the goal was to create an evidence-based, user-friendly learning tool or training tool that CRNA preceptors can use to enhance the student learning outcomes and reduce stress on both CRNA side and the student side of the equation. So some core learning objectives of our session as we work through this training: CRNA preceptors will hopefully gain some structured communication strategies, especially useful in high-stress OR environments. We'll explore adult learning theory in the clinical setting, dive into common challenges in preceptorship, and hopefully provide some practical training tools that foster critical thinking in our SRNAs. Importantly, this is also an opportunity for preceptors to reflect on and grow their own practice. Let's start with an introduction. The purpose of this module is to promote the consistency in how we train SRNAs. Across many institutions, the preceptorship is highly variable. Some preceptors provide rich, structured feedback, while others may not have received any formal presentation or preparation on how to teach or what they can teach. This inconsistency can lead to some confusion, stress, and occasionally lower performance in SRNAs. Ultimately, the preceptorship has a direct effect on patient safety and outcomes, and our goal here is to challenge that through education and awareness. The role of a CRNA preceptor goes beyond supervising a student. Preceptors are mentors, evaluators, and often role models. But what does effective preceptorship look like? Research shows that unclear expectations, the lack of preceptor support, and minimal feedback mechanisms are common issues. This module aims to establish a shared foundation for success so that both the preceptor and the student are supported. Effective communication is the bedrock of successful preceptor relationship. We'll explore the SNAPS model, a learner-centered method that encourages SRNAs to present, analyze, and plan cases with guidance. SNAPS stands for summarize, narrow, analyze, probe, plan, and select. It encourages the student to take initiative while the preceptor provides clarity and correction. We'll also look at examples of constructive feedback, especially in high-pressure clinical settings where time is limited. We'll be adapting the SNAPS tool for our anesthesia cases. In this project, the SNAPS tool will be the foundation of how you change the way that you train the students. SNAPS tool, once again, is summarizing the case, narrowing the differential, analyzing the differential, allow the student to probe the teacher, plan management, and then selecting an issue for self-directed learning. We'll be adapting this to our anesthesia model. We'll review that adaptation in part 2.